Hello everyone, this is our new video about Charcot Marie Tooth disease. So let's get started. Before we proceed, I wanted to review that our nervous system consists of a central nervous system and the peripheral nervous system. The central nervous system consists of the brain and the spinal cord. This is like the headquarters of the nervous system of the body, from which all these peripheral nerves emerge to supply the rest of the body. Our disease, which is Charcot Marie Tooth, affects the peripheral nervous system and does not affect the central nervous system. Charcot Marie Tooth disease has been named after the three neurologists who discovered it, Charcot, Marie, and Tooth. So this is a hereditary motor and sensory neuropathy. Motor neuropathy means it will result in muscle weakness, and sensory neuropathy means it will result in sensory defects. And as we said, it affects the peripheral nervous system. It does not affect the central nervous system. It's actually a group of related diseases. It's not a single disease. It's a group of diseases that has been grouped together and called Charcot Marie Tooth. This group of diseases are frequently either undiagnosed, misdiagnosed, or diagnosed later in life because they look like other neurological disorders, so it's hard to diagnose it as Charcot Marie Tooth. It's usually either diagnosed in early childhood, early adulthood, or even later. This is the most common inherited neurological disorder. And inherited means if somebody is affected, they can pass the disease into their offsprings. So it can be transmitted from one parent to their offsprings. I wanted to point out that in any disease that affects the peripheral nervous system, the longer the nerve, the more susceptible to be affected first. And that's why in Charcot Marie Tooth, as in other neurological disorders that affect the peripheral nervous system, the longer nerves, which are the nerves that supplies the lower limbs mainly and the upper limbs, are going to be affected first. And that's why most of the manifestations or most of the prominent manifestations of this disease will affect the lower limbs, and next is the upper limbs. And that's just simply because the nerves that supplies these limbs are long nerves, so they are more susceptible to damage. So, for example, foot drop is a frequent initial symptom. This is in addition to muscle wasting because of the loss of the nerve supply to the muscles, cramps, spasms of the legs and arms as the disease progresses, loss of sensations of the lower and upper limbs as well. Unmyelinated pain nerve fibers are typically spared, and this is because, as we're going to see later on, most of the pathology of the Charcot Marie Tooth has to do with the myelin. So if the nerve is unmyelinated, it's very simple that it's not going to be affected, and this is the case here. Some patients, unfortunately, may experience neuropathic pain that can be very debilitating and very damaging to these patients. Here are some of the signs and symptoms of Charcot Marie Tooth. But before that, I want to point out that in order for the skeletal system to grow normally and in the normal positions of the bones, you have to have normal functioning muscles and you have to have normal muscle tone. So if there is a defect in the nervous system that will reflect into weaker muscles and weaker muscle tone, the skeletal system will develop abnormally. And this is exactly what's happening here. So some of the skeletal abnormalities that happens with the Charcot Marie Tooth include something called pes avus, which simply means high arched foot. And it can also cause flat foot or pes planus or flat arched foot. Because of the loss of the most peripheral muscles of the limb, this can give us something called inverted champagne bottle. This is a champagne bottle, and you can compare this with this legs here. You can see the similarity of the two things. Charcot Marie Tooth is a group of heterogeneous hereditary disorders. Heterogeneous means it's multiple types. So there are multiple types of Charcot Marie Tooth based on the genetic mutation. It's not a single disease as we discussed earlier. So it's caused by genetic mutations in the structural proteins forming the myelin sheath, and this is the most likely scenario, or in very little cases, it has to do with the nerve axon itself. In fact, the most common genetic mutation affects something called PMP22. This stands for peripheral myelin protein, and that's present on chromosome number 17. All these are high-yield points that can be asked in exams. This peripheral myelin protein is interesting, and this is because we don't really know what's the function of the peripheral myelin protein, but its presence is essential for the function and the maintenance of the myelin sheath. And it turns out that if we have too much of this peripheral myelin protein, this will result in Charcot Marie Tooth. On the other hand, if we have too little of this protein, this can result in a different entity of disorders that's beyond the scope of this video. But we need to know that PMP22 is the major defect or the most common defect that can result in Charcot Marie Tooth. Another less common mutation is a mutation affects a gene called MFN2 gene, which stands for mitofusin 2. From its name, mito refers to mitochondria and fusin stands for fusion or refers to fusion. This protein has an important role in mitochondrial fusion. Mitochondrial fusion is important for the function of the mitochondria. So we can conclude that if there is a defect in this protein, the mitochondrial function will be impaired. And this is another mutation that would result in Charcot Marie Tooth disease. And also there are many other mutations that can result in the same disease as well, but it's less high yield to mention it. There are three ways to diagnose Charcot Marie Tooth. The first is nerve conduction studies. Nerve conduction studies will show a delay in the nerve conduction, obviously because there are defects in the myelin sheath. But this is very non-specific because a lot of diseases could show the same thing. So this is not diagnostic of Charcot Marie Tooth, but it's very suggestive. The second thing is nerve biopsy. So if we take a biopsy from the nerve or the peripheral nerve, what it will show? It will show something called onion bulb appearance. This is an onion, and these are the bulbs of the onion. And the reason for this is the continuous degeneration and regeneration of myelin. So you will have degenerated myelin and then regenerated myelin, and this again becomes degenerated and then regenerated again, and so on and so forth. And this will show this onion bulb appearance on biopsy of the peripheral nerve. But the most definitive way to diagnose Charcot Marie Tooth is through DNA testing and showing the DNA defects that we discussed earlier or other defects. Unfortunately, not all the genetic markers for Charcot Marie Tooth are known to us, and this is the problem. Unfortunately, there is no cure for Charcot Marie Tooth. It's the effort of multi-professional team including occupational therapists, physical therapists, podiatrists, orthopedic surgeons, and trying to alleviate the manifestations of the disease on the patient. The thing is also, life expectancy is not altered in the majority of cases because it's mostly a musculoskeletal disease and it doesn't affect the major organs of the body, so the life expectancy is not really altered. This is the end of the video. Thank you very much for watching. Please don't forget to subscribe to our channel, and please also follow our Facebook page, Medical Borditis, for more interactive questions and answers and more high-yield material. See you next time.